This episode of Bartholomew Town is brought to you by the University of Rhode Island Online, Newport Film, Navigant Credit Union, Half Street Group, and Health Source RI for employers.
Bartholomew Town.
All right, so last week they roll out RFK Jr. and the president for a press conference, and this was in the midst of so many things that are happening, which has kind of been the playbook for the Trump 2.0 administration anyway, get as many things happening simultaneously to sort of divert scrutiny as much as possible. But I was on the radio last week and I saw, good, RFK is going to come out and make an announcement on autism. We learned that that was going to be something that was linked to Tylenol. And look, there are long-standing, well-known public health practices around pregnant women taking Tylenol. There's been recommendations directly from the manufacturers of Tylenol and generic acetaminophen producers that you may not want to take Tylenol if you're pregnant unless you're, in fever. This is long-standing stuff. Yet, surprise, RFK Jr., the same people tell you we shouldn't have vaccines. Now they're telling you Tylenol causes autism. Breaking this all down and more for us, someone who is no stranger to the podcast or Rhode Island as a whole, and that's Dr. Amy Nunn. Doctor, good morning, and what a time to be alive.
Good morning.
What's your initial reaction when you see a headline or even start to dig into some of the studies, be it the Mount Sinai study, the Chan School of Public Health study, anything else around all of this? What's your initial thought from a public health standpoint?
Well, it's pure chaos, and I think it's designed to instill doubt about a very commonly used over-the-counter medication. The main thing that I think people need to take away from this is that this has really been blown way out of proportion. There are existing national and international guidelines about acetaminophen use during pregnancy, and people don't need to be too concerned.
What about just from the standpoint of looking at this holistically as part of a broader reshuffling of the deck, if you will, around public health? Look, RFK Jr., somewhere along the line, he went from kind of an interesting environmental guy, kind of an edgy character in semi-politics, to all of a sudden appearing on podcasts telling you that the COVID vaccine is the worst thing you could do and that it should be, viewed as a national emergency. It seems like these guys have embraced this policy of doubt the science that you maybe grew up on, doubt expertise, squash knowledge in general. So even as something like this is rolled out and it's hyper-specific to alleging that Tylenol causes autism, what does this do to the broader ecosystem of public health for the average person, just from your standpoint?
I think what I'm worried about is that people are going to start focusing on the wrong issues and that the person at the helm is orchestrating a lot of unnecessary chaos about the wrong things. These are things that don't have a lot of major public health significance. And what we should really be concerned about are the big upcoming cuts to important public health programs like Medicare and Medicaid, and also the SNAP program. There is a cliff looming for a lot of really important safety net benefits. And that is the thing that we're most concerned about. And we're also concerned about misinformation and disinformation. We are worried that people don't know where to turn to, and a lot of people might get panicked about some of these issues that really are not very significant.
Right. So let's focus in, if we could, just on this issue of acetaminophen and allegations or very specific crunching of data and observational takeaways from some studies on, I guess here's the plain English. Where the hell did this come from? And what do you make of any of the studies that are softly suggesting there could be some neuro issues with acetaminophen intake during pregnancy that go beyond what we kind of already know and have known for decades. What's your takeaway of where this came from and from the science standpoint? Is there anything to this?
Yeah, so I actually read all of the most of the science related to these issues and all of the national and international guidelines about it. And basically, it there are some very tenuous associations that don't really imply or can't be linked to causality. Most of the studies, including one published last year in the Journal of the American Medical Association with 2.5 million um, observations over 25 years in Sweden, have found no associations between acetaminophen use and um, suboptimal birth outcomes for autism or ADHD. Most gynecologists believe that acetaminophen use during pregnancy is important. And I think the other public health takeaway that's really important is it kind of depends on what you're using it for. One of the things I was most concerned about is there are two things. One is that the president told women to tough it out. That's inappropriate and not important. And it's inappropriate and not something that people should be paying any attention to. And the reason is that a lot of people take acetaminophen during pregnancy for fevers. And that's something you never want to ignore because uncontrolled fevers can have a very detrimental impact on babies in the womb. And that is what gynecologists and obstetricians are most concerned about, is that there may be people with uncontrolled fevers as a result of this announcement. The bottom line is if you're pregnant and you have fever or you're in pain, you need to call your physician so that they can look at your nuanced case and guide you in the right direction. You should not tough it out. That is inappropriate medical guidance by someone who has no background in training on the issues.
Yeah, I think that's the real thing that comes to mind. I think of Tom Nichols of The Atlantic, Newport, Rhode Islander, in his great book, The Death of Expertise, which is, it highlights just how little faith so many people seem to have in what should be baseline expertise, MDs and other public health professionals over somebody like Robert F. Kennedy Jr. and the Trump administration, or anybody for that matter. But it just feels like we've gotten into a broad acceptance of at least skepticism, if not overall junk science. So for you as a public health professional, I mean, what do you do to combat this kind of junk science when they have the megaphone and the platform of the White House and television, radio, and digital distribution of their message? What's public health to do?
Well, one of the things that I think we need to do a better job of is spreading information ourselves. And that's why I'm here today, because a lot of people do get their information from podcasts and less mainstream media sources and so we need to flood the airways. We at the Public Health Institute and Open Door Health believe we do have the trust of the community, and everything we do is grounded in scientific evidence. And so we're spending a lot more time trying to educate the public about important issues.
Yeah, I mean, that makes the most sense, right? Just get out there and do it and continue to sound the alarm. You've obviously built your own, brand and credibility and all of that, but also just relationships with your clientele broadly, patients and otherwise. So for that person out there that doesn't necessarily have anybody that they trust, maybe they don't trust their doctor, maybe they don't have a doctor. That's not something that can be taken for granted at this point. What are some of the keys to look for the very baseline person who pays very little attention to news or public health or anything like that, and they hear, oh, somebody told me Tylenol causes autism and ADHD, so maybe we shouldn't take Tylenol. What do you say to that person in terms of just getting focused on information, even for a very short period of time?
I would
That is
say that
actually
first,
beneficial.
ask your doctor. Secondly, a lot of the physicians associations are also getting involved in um, disseminating important public health information in layman's terms. For example, the American College of Obstetricians and Gynecologists has issued what they consider to be best practice guidelines. So, if there's an issue you want to know something about, first of all, you can always come to us. We have a lot of information on our websites about a lot of different things. But for new issues and emerging issues, it's good to think about the physicians' associations and what the group of experts believe should be best practices. I know that we've been working closely with some of those associations, also in disseminating important information about vaccines, for example.
Right. And that leads me to the question that has changed public health forever, and that is COVID-19 on
Mm.
so many levels. COVID-19 allowed for an ecosystem and an attitude shift towards public health professionals that is, to my mind, was totally unfathomable. And then yet we saw it roll out every single day, seemingly getting worse and worse as, from my standpoint, getting questions from listeners that were shocking, that they expected me to go to the governor or Dr. Alexander Scott, former director of the Department of Health, uh, or you or Dr. Philip Chan, anybody, and credibly sit there and say, well, these vaccines, they've got microchips in them. And these are literal questions that people were expecting to be answered. So we're now in this soup of post COVID. How do you educate people as a public health goal for 10, 20, 30 years to rewrite the ship when it comes to people's faith in the broad experts and broad system that doesn't seem to necessarily be there, at least in some corners?
Well, I think we have to build back trust. That's one thing that's really important. And so we're spending a lot of time trying to do that. I think the other thing is that um, we have to explain sometimes how science evolves. Sometimes people want absolute answers. I think one of the challenges with COVID is that it was so new and it takes usually a really long time to completely figure out a disease. And we did it in record time, but we lost a lot of public trust along the way when we were taking a lot of precautions because people were dying at really high rates. And so we have to build back trust. And I think we have to get into some of the and share information in some of the networks where there may be a lot of skepticism. So we are spending a lot of time at the Public Health Institute trying to do those things and to build back trust.
Mm.
And I think that that's increasingly more important. I think we also learned a lot from the pandemic. Americans don't like mandates. In Europe, in systems, public health systems, people are more accustomed to them. And sometimes people really bristle now when we require things. That's kind of a uniquely American phenomenon. But one thing that we do instead of talking about mandates is talk about what we do. So I talk about my experience with my family. Our physicians talk about their experiences with their families and what they tell their patients. And I have found that those messages often are better than other ones related to mandates. So we're changing the way that we talk to the American public.
Yeah, I think that's probably something that has to be embraced a little bit more. I can say, just from the standpoint of the media side of it and being on the receiving end, mandates, people don't like them. That's for sure. All right. One last thing on the Tylenol. what do you, is this opening up a situation where now the precedent of peer-reviewed, well scrutinized, well established claims of significance. And this is, I was speaking with, for example, my mom about this the day that this happened. And she said, what are they going to do to mothers that may, maybe they have a child who's neurodivergent, and now they're reflecting back on, geez, did I take too much Tylenol? This is psychological warfare as well at a certain level. And it seems like if you're going to say Tylenol causes autism, definitively from the available science, which there's very, very, very little, as you've just spoken to. I mean, where do we go from here? What's next? Are they going to tell you that if you drink water, you're going to grow a sixth toe, and now people are going to believe it? Like, is there a ceiling, and how do you prepare as a public health professional for an environment that doesn't seem to have a ceiling as to the outrageousness of some of the claims that are being made and sold to the American people, and perhaps even on a global basis?
Well, it makes me sad that a lot of women may feel guilty about these things. That's certainly an unintended consequence, I think, of these kinds of vast dissemination efforts of disseminating misinformation. And that's not helpful in any context. Autism is usually considered to be caused by it's a genetic disorder, and it can be activated with environmental or social circumstances. But it's not totally well understood, and so we don't want women feeling badly or guilty about taking Tylenol during pregnancy. So that's a really important message for any pregnant women that are out there listening. Don't feel guilty about that. If you have any questions, just call your doctor and ask. But most obstetricians believe that the health harms related to foregoing acetaminophen are much greater for the fetus and the mom than any teeny tiny risks associated with taking acetaminophen. And that's not just my opinion, that's the opinion of all of the associations of obstetricians and gynecologists nationally and internationally. So get your medical advice from physicians and public health experts, and not from politicians. That's kind of the bottom line here.
Well said. I mean, that's the soundbite that everybody needs to hear. Dr. Amy Nunn, Rhode Island Public Health Institute, Open Door Health, a treasure in our community. Thanks so much for stepping forward today and for delivering this message. And I think a lot of people that are hearing this are probably nodding along, would be my guess. But let's hope, at least in the first audience, but let's hope that this is distributed to people who are skeptical.
Thank you, Bill. Can I offer one more thing?
I'd love that.
I think the other thing that I want people to take away from today's podcast, that there's also been a lot of doubt cast on COVID and flu vaccines. Nothing has changed since last year, only in terms of the science. The vaccines are safe and effective, and they're really important. So everyone should get vaccinated for COVID and flu. Nothing has changed since last year, and that's a really important public health message. The only contraindication for getting a COVID vaccine is if you've ever had an allergic reaction. So everyone, remember to get vaccinated.
And if you had an allergic reaction, are we still at a point where the multiple different manufacturers are available, and that's a tool that can be used so you can still get vaccinated if it's the Pfizer, Moderna? Where are we at in that? Where, is the reaction typically something that's an ingredient in all of the vaccine that's available?
I think that's something that the allergic reactions are quite rare, but that's something that people that have had them in the past should take up with their own physicians. Gotcha. Because it may depend on what caused the reaction.
Makes complete sense. Dr. Nunn, thanks so much for your time. Rhode Island Public Health Institute, Open Door Health. How can people get in touch with you or your team at RI Public Health Institute and Open Door Health?
Yes, our websites are www.riphi.org or odhpvd.org. You can also follow us on TikTok, Instagram, Facebook, and LinkedIn.
You're getting out there, and that's something that is deeply appreciated. No doubt about it. Thanks for your time today.
Thank you.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,200 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our more than 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health and dental insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.